Hi, I'm Dr. Alan Lazar. I'm an arthroscopist. I do arthroscopy of the shoulders, knees, and I do a lot of different surgery. Recently, I've incorporated a new procedure into my armamentarium of things I do to help people. And what I do is I use stem cells and platelets in order to heal ligaments, tendons, muscles, and I can grow cartilage in an arthritic joint. I take stem cells from bone and from fat. I take your blood and I extract the platelets, and I utilize the growth factors in the platelets to grow the platelets in a joint or tendon. Arthritis is basically the loss or damage of cartilage in the joint. So it's either cracked, damaged, loose, thin, and this is the reason we become symptomatic, because the joint gets inflamed. So in order to treat it, up until now, all we did is treat it with cortisone or some other hyaluronic injections, but nothing really did anything to the problem, the true problem, and grow cartilage in the joint. Now we can actually grow cartilage in a joint, and what I do is I actually take your fat from your tummy, and I take your blood, and it's just having like a little stick for a blood test, and I localize your tummy where you don't even feel it's local anesthesia, and I take that fat, I take the stem cells out of that fat and put it into your joint with the platelets, or a tendon or a muscle. Like if you have tennis elbow, I can treat that. If you have a rotator cuff tear, I can treat that.
I came to Dr. Lazar because I've already had surgery on my right shoulder about 3 times, which none of them have worked. And now I found out about the stem cell platelet, and was looking forward to something that will relieve the pain that I go through every day. I had the first injection done about 6 weeks ago, and so far to me it's worked about 75%.
That's wonderful. 75% after one treatment is above the average. And let's see, can you have any difficulty doing anything? Any problems moving it, or
no? None at all.
Nothing, activities of daily living, and no problems.
None at all.
Okay, so the plan is to do one more injection. This treatment usually consists of two injections on the majority of patients. When we have a problem like his, we use platelet-rich plasma, and we use stem cells from a fat graft. As you saw, we did a little mini liposuction, and we take his blood from his vein, spin the blood, take the platelets out, put it together, and we put it into the inflamed area, which is in case was the tendons and the joints. And that's great. So after the second injection, we can expect either complete relief or at least 90-95% relief of the symptoms.
I'll be satisfied with that.
Me too. I'm looking forward to it. The most common questions you might have about this procedure is the pain and discomfort you have, how long it takes to work, and the risk of the procedure, and what happens to the cartilage you already have in your joint. There's no risk of the having to go to sleep, or any nerve, or any damage to any tissue. Normally it takes about 6 weeks to grow cartilage in a joint. Ligaments and tendons heal, some heal rapidly. I personally had this done, and it took me 3 days for my ligament to heal. A lot of people take more, and sometimes weeks, but the most is about 6 weeks. Cartilage that exists in your joint is not damaged. We're only adding more cartilage to your lack of cartilage or your damaged cartilage, and it has no ill effects on the joint, and there's no side effects. You might have a little aching where you had the for a few days where you had the liposuction. I do a mini liposuction, and you really don't need to restrict your activity. This makes for a seamless procedure. I first started doing this about 2.5, 3 years ago, and I've taken people that have rotator cuff tears, tennis elbows, injuries to their muscle, and rather severe amount of arthritis. And I've injected them, and they're very happy people. I've had people come back here and say, "Doc, I am absolutely 100% normal. Thank you very much." And I've also taken people that can't get out of their bed to go to the bathroom because of profound severe arthritis in their hip, for an example. And I've taken them and given them shots of the growth hormone and platelets into their hip joint. And on the first injection, just last week, I had a patient had 80% relief of her symptoms with one stem cell and platelet injection. It's really a pleasure to see these results, and without hurting anybody, with no risk to them.
So what are you going to do today, Mr. Caban?
I'm going to Disney World with my wife.